from MAM 2026 lessons to El Nino 2026 preparedness. So, to the Directorate of Agriculture, we heard from them and we heard from you that the MAM 2026 session had crop performance which was very good and it was mixed. Some areas flourished, other areas had challenges. Now, based on your assessment in the field, we want to understand what is the single biggest systemic weakness you observed in the agricultural extension system that we must fix before OND 2026. We want to understand what is this single biggest systemic weakness that was observed in our agricultural extension system that we must fix before OND. That is my question to the Directorate of Health. Karibu.
Okay, thank you, Maside. And I am happy that you have so many pens in your pocket. I hope I'll get one. Now, the quick link that should be there between, let me say, of the PSP and the Department of Agriculture. One, these messages that we are giving our community is to make sure that they are well enlightened so that they know what to plant and what not to plant. For example, the MAM rainfall had two distinct advices, especially as far as the rainfall about the normal and the below normal, and the other one normal to above normal. Those two areas were supposed to have two different crops which were supposed to be planted. Now, the OND is here coming with us. The only advice that we can give to the farmers is that they are supposed to prepare themselves with seeds which are supposed to be late maturing. Late maturing means that they are going to take slightly longer period and requires higher soil moisture compared to what we had during the MAM season. The MAM season, we required crops which did not require high moisture content in the soil. But with the OND, we require crops which require high soil moisture content. Otherwise, if we make a mistake of having the what we call the short range crop, the chances are that they are not going to produce. But if we have the crops which requires higher moisture content, then it means the prolonged OND rainfall is going to support those crops up to maturity stage. And we have all those varieties, the long rains, the short rains, and all that. The messages to the farmers is the most important. Thank you.
Thank you so much, Director. I think that has been expounded, and I would like to open any addition from the audience, if at all you have something you'd like to pose to the Director so that you can get a response, please. If you're still noting your question, I'll move next. When you're ready, you let us know. Next, I would like to hear from the County Director of Livestock, who is with us. Pastoralists reported in some cases in Kajiado County that the heavy rains that arrived came with some challenges, particularly when it comes to veterinary services being accessible. They were few and in some cases not even reachable. So what is the county's plan to preposition veterinary services before OND so that we are able to support them in whatever they do.
Good afternoon. Thank you, moderator, and also thank you, listeners. I think it's a pleasure to respond to that question. As a county, in related to vaccination or in related to preparedness on disease control, there's a a kit or a county veterinary fund that is being developed in the county level, and we hope that if this one goes through, then the preparedness or the response to vaccination will be key in that will be undertaken as a county. So we are hoping after the fund has been developed and successful going through the stages, then we will be responding well to the diseases in our county. Thank you.
Wow. The county is setting itself ready for the OND in case the KMSA would align with the focus that has been provided. Any additions from the audience, please, to the livestock department of the county? We had so many questions during presentation. I want to hear them now to be responded in this forum because I'm taking note. Yes. Yes.
Three major livestock diseases. The common foot and mouth disease, which I appreciate because the county have been very okay in providing the vaccination for that every year. And we had rinderpest, but the worst of all, which killed many, and up to now we still don't have a solution, is the blue tongue. I don't know whether the county has got any method of trying to cap that problem, because it always comes with the heavy rains.
Okay. We have another question? Okay. Wow.
Yes. My question goes to Director for Livestock on the issue of maybe sensitization on reaching on vaccinations in the community level, because we are seeing that the vulnerability peoples have been left out. Those who have been vaccinations on livestock, they are the people who get only the information that there is vaccinations in a specific area or in a specific place, but those peoples who are not able or even who are not getting the information, how do you tell us or tells this meeting that in the OND that we are going, being able to reach the vulnerable people who are inside the community levels? Thank you.
Okay.
Santi?
Okay, mine is just also to direct to the Director of Livestock. Because I have heard that they have a plan that they are developing some funds for the preparedness of the vaccination of livestock. I'd like to ask if the plans go through, will they vaccinate livestock across the whole county, or it should be a selective vaccination? Secondly, I would like to ask what measures, especially surveillance measures, are they undertaking currently to contain diseases, especially across borders? Thank you.
We can have one final one, then you can respond.
Asante. Swali langu ni kwa livestock. Tumeambiwa na yule mzungumzaji aliyezungumza wa World Vision, mwisho kwa vitabu mambo ni mazuri sana, lakini ikija kwa ground hakuna kitu inafikia mwananchi. Hiyo mambo ya vaccination tumeisikia mwaka kuja, mwezi kuja, mwaka rudi. Alafu wakati wanasema watavaccinate ng'ombe, ninataka kuuliza huwa wanatumia kriteria gani? Kwa sababu mahali huwa wanaweka ati ng'ombe zote zije si mahali central, wanaipeleka mahali sijui ni interest iko, sijui ni nini iko, kwa sababu wengine hata tunasikia ikiwa imeisha. Kulikuwa na huu mradi wa kubadilisha mbegu. Ajabu ni kwamba Ukiwa Kajiado East mwisho ule ilipelekwa mwisho ingine ambaye hata huwezi kupeleka ng'ombe. Sasa ninataka kuuliza ni kriteria gani huwa mnatumia? Kwa sababu Kajiado tumeumia sana kama wakulima na kama wenyeji. Kwa sababu mipango inapangwa mpaka tukaambiwa ati Kajiado ndio the richest county, na ikisemekana ni richest county, ukienda huko ndani kusema ukweli si richest. Kajiado ndio mwananchi alikufa pande ile ya Ingirigiri kwa sababu ya ukosefu wa chakula na kwa sababu ya ukosefu wa maji, kwa sababu wenye kuchukua statistics wanatoka Nairobi barabara paka Namanga, wakijionea maduka wanafikiri wote tuko madukani. Tuko huko ndani.
Asante.
Unatumia kriteria gani? Muhakikishe kama ni vaccine ifikie wale watu wa huko mbali.
Okay, asante. So I think I can respond to those 4 questions, then we make progress. Yeah.
So thank you. In response to these questions, because they are specific now to veterinary department, one, on surveillance, department has a specific department on surveillance, disease surveillance, and they have a response or reporting system where if there is a disease in a particular location, there's normally the reporters who report the diseases to the county surveillance officer, and they will be able to report on the case. On matters of vaccination, I think also that one will respond to, there are those one who are localized, and then there are those one who are done county-wide. So for the county-wide, I'm very sure that sensitization normally takes place before the vaccination has been undertaken, and that has been the norm. And on the criteria, the criteria has always been in the community level, because first, if there is a place that vaccination has to take place, there is a report that is issued to the local leaders through the administration, and then the community in conjunction with the local leaders, they decide if there is a crash that's available, because those are the important infrastructure that are being used in this service. So I think that one also relates now to the community getting information, and also designing or collaborating with the leadership to give advice on where the services being taken. So I think for that one, and for sensitization, I think during the PSVs also, the veterinary officers are always invited, and they also give advisories on these barazas. And in the other barazas, they always are available to also offer the sensitization services. And I'm very sure in almost all the sub-counties, we have veterinary officers who are also available on call to give guidance on the same. Thank you.
Asante Director. Perhaps you might want to provide the contacts of the various service officers to community members so that they are able to reach them, and they might not be able to ask perhaps which corner or which criteria is used. Then that will ease in communication at a later stage. But thank you for that response. I know there is much you could want to learn about livestock. So these directors are with you, and you can always pick even their contacts and talk to them, and they'll be able to advise strongly in those regards, even in the forums you share. For the interest of time, you'll allow me move to one of our partners from the Inuka for Community, Mr. Victor. We understand Inuka works directly at the grassroots, particularly in the south, Kajiado. It has done so well. And you are emphasizing on behavioral change where you are utilizing the community. So we want to understand from this perspective, what is the biggest behavioral change you usually anticipate to see in this community? And perhaps what are some of the barriers that are making this change not happen instantly, so that they can understand and also support you in the program? Thank you.
Thank you so much for such a wonderful question, and which is very community sensitive. One of the things that as Inuka, together with our partners, CARE, we stand for is community-driven change. And that is what we believe in. So the project is called Sowing Change. Means kuna mbegu tunapanda na hii mbegu tunataka imee. So one of the behaviors that we have yearned for is where women and young people, that's the youth, take part into the leadership role when addressing matters of climate change. Because many a times, when you talk about the climate change, like we are talking about El Nino, one thing you said here is that those who will be affected more are the young people and the women and the persons with disability. But now the big question is, where are they when it's come to planning, designing, implementation, monitoring? Yeah, where are they? That is the big question that we are asking ourselves. And that's what we expect from the community. If you are being selected or you have been invited, because we cannot invite everybody into this forum. But now, what are you doing with this information? Are you that person who this day you are at ACK, the other day you are in Chula, the other time you are in Baptist, the other time you are... But by the end of the day, the change can only be seen within your fence, not even at the neighbor's point of view. So that is what we are looking for. We are looking at for the community members who are going to come into this place and going back and start with the neighbor and the other neighbor and the other neighbor. So when we are coming to tell a story, I don't want to listen to a story from my direct contacts. I want to listen from a story from the direct contact of the persons that came to this meeting. That is the behavioral change that we anticipate. And that is what is going to change. I believe it's going to help all other interventions that the county is doing. The county cannot be anywhere, everywhere, but we can be the champions of change, and we can make sure that the information we are going to get here, we are getting from here, this place, is going to create an impact at the community level. When we are talking about nature-based solution, it is very unfortunate that you can produce more, but the first thing is that you cannot feed everybody in your community. How about you make sure that your neighbors also understand the nature-based solution? So that as you produce more, they produce more, and with that surplus, then there will be no people losing their life because of hunger. That is the behavioral change that we stand for. Thank
you so much. Some of the barriers perhaps you encounter.
Yeah, the barriers has been there. One of the key barriers of Kajiado is how vast it is. I was talking to the director today, and we are asking ourselves, is that he was asking me that some of the data monitors from Kajiado South have failed to come to the training. Why? Because for them to travel from Rombo to this place and go back, that person needs close to 5,000. Now, will I spend the 5,000 to come for the training, or I can use it to do some weeding at the farm there? So you see, the varsities affect the proximity to where the service is being rendered is very important. Another example is what my mother here has said, is that where the animals are being taken is far away from where they are. So the proximity of a service delivery is very, very important. The next thing is the mode of delivery. The mode of delivering this information. That is also very important. Today I was saying that as Inuka, there is no single training we facilitate in Kajiado South. All our trainings at Kajiado South are either done by the ward officers, extension officers, or sub-counties officers. You know why? I will win another project that talk about Bilazia, and I will leave. But the ward officer will still be there. The sub-county officer will still be there. So one of the things that we need to do, as this one goes to the partners, let's work with the existing systems. With the existing system, you are going to empower that community. Another barrier that exists currently is the spaces, opening these spaces for youths and women. When we were doing the dissemination last year, in that, was it a church? If you look it through, close to 70% were men. And so the big question is that how do we be gender responsive in when designing the spaces for public participation and community engagement? That is something to talk about. That's an area that we really need to look. So all in all is being intentional in our engagements. Like for today, I can say, how many of us come from South in this room? Any community member from South? That's the reality.
Okay.
There is one. Thank you so much. So that is the reality, and that is what we are talking about, being intentional in every platform where a decision is going to be made. That one will give us a result. Thank you so much.
My partner, Kenya Climate Change Working Group, Ms. Wanja.
In rare circumstances, we also allow individual membership. So if you want to join us, there is a tab on a membership tab on our website. Just click on it, then I think it should direct you to the membership page. And my colleague Dennis, I don't know if you've met him, he will be able to support in that process. Membership is currently free and open. So in terms of the achievements, start with one, I think improved access to very friendly to the communities here. And the recommendation was that if this information can be communicated in Swahili and if possible in my language, and also the use of radio as a communication platform. And we took these recommendations seriously. And for the last 2 years, this has really improved and people are able to receive this communication in good time. And we are also leveraging on the existing platforms like bus radio and other mass stations to ensure that we are able to reach the last mile. And when you go to the barazas for dissemination, we tag along our sub-county officers who are mostly from the Ma community, and they're able to pass this information in the local language. And we are also working closely with the chiefs through the county commissioner's office. And through this, we are able to have a wider reach in terms of the dissemination. Another maybe success, I can say we've recorded improved resilience. Because like I mentioned, we worked, through the other project, we used to work with TOTs whom we journeyed with for the last 3 years. And the TOTs were also members of different groups back at the community level. And during our M&D sessions, we used to visit the groups just to assess the impact of the work that we are doing. And one of them was the uptake of climate smart agriculture initiatives, which of course we delivered with the Department of Agriculture. And there's great progress in terms of uptake of climate smart agriculture initiatives, and also using climate information service to inform agricultural practices through the PICSA trainings that we're able to conduct. Also in terms of energy, again, when we were starting the project, we did a quick assessment of the barriers to uptake of sustainable energy, and we were able to identify the gaps and come up with recommendations. And I'm happy to report that by the end of the project, most of the beneficiaries had transitioned to different clean energy technologies, be it in terms of solar, be it in terms of, even in Kajiado South, we had some of the women forming chamas, whereby every month they could buy one of the members an electric cooker. And they're able to report on the progress or the gains that they had made from such an initiative. One of them had even opened a shop. So we are looking at energy, not just for lighting, but going an extra level in terms of the productive uses of energy, be it in terms of the related enterprises, and also clean cooking, etc. And I think also looking at gender mainstreaming in climate work, be it in terms of leadership and governance, be it in terms of meaningful participation of special groups. I can say that we've seen that improve even in terms of the committees that we have at the county, at the very community level. Women, youth, and also most importantly, the PWDs are now taking up the spaces in terms of leadership. and they're also being engaged as equal players in this space. In terms of implementation of the policies, I think we have different organizations and different institutions with very clear mandates on what they're expected to do. So for us, it's just influencing and also building the capacities of the communities and the CSOs within the counties to be able to hold the duty bearers into account, be it in terms of developing community scorecards, training them on social audits and others. But in terms of mandates, mikono yetu kuna mahali imefika, so ours is just to build the capacity of the people and also maybe reviewing the policies, just assessing if the policies in place are implementable, what are the emerging issues at, like I mentioned earlier, we also have engagements at the international level. What are the gaps that maybe new developments at the international space that needs to be domesticated at the county level? What are the gaps that maybe a review of such a policy could allow the policy at the country level to be in tandem with the international conversations or discussions around that thematic area? That's a process that we are very much interested in. We've done the same for the other cycles. So once that process is ripe for consultations, we'll be happy to, if not directly support the process, but convene stakeholders, especially community and user groups, just to have their voice also influence this important policy framework. At the national level, we have a couple of policy processes, including the National Climate Change Action Plan. We were part of and parcel of the Gazetted Task Force that did the first, the second, and now the third. We also have the Gender and Climate Change Action Plan, which will be guiding the implementation of the National Climate Change Action Plan. I was part of the task force. We also have the agroforestry strategy, the nationally determined contribution, the NDC, and we also participate in the drafting of country position papers that are used for negotiations at the international level. So that is for the UNFCCC, and also next month we'll be having the 17th COP for desertification. So we are part and parcel of the planning team, and the first week of August we'll be having a write shop to develop the country position paper. And like I mentioned in the morning, we'll be celebrating this year as the International Year of Rangelands and Pastoralists. So next week there'll be a convening in Enchula by different partners who are supporting that, to start the preparations towards that celebration, and many other activities and interventions in there.
Thank you so much. You can see KCCGW, weather extremes in this county, particularly Kajiado, come also with a number of health challenges. And in the scenario that we have El Nino that is being projected to come in the O&D, then we might have an uptick of health issues related even to diseases. Perhaps people would want to understand, or the county want to understand here, what is the status of rapid response mechanisms at the county level or at the different wards, or how are we going to prepare in terms of rapid response in case we have El Nino occurring? Thank you.
Thank you for that question, and it's actually timely because we are looking forward to having El Nino. For the health department, the strength that we have is that we have structures from the top to the bottom, and they are very well established, and therefore we are ready for any emergencies. When we look at the forecast, then El Nino that is coming, we are expecting several probabilities in terms of health events to occur. And the obvious one is communicable diseases. We start with that. Communicable diseases that involve vector-borne diseases, waterborne diseases, and others. And we have a lot of diseases in those categories. We go eliminating them one by one. For example, for cholera, Vibrio cholera bacteria thrives best in small amounts of water, not large amounts. So we might not really expect to have cholera, but we might expect to have typhoid or even polio, you know. So it is an area that, in terms of epidemiology, we study depending on the areas, because epidemiology is the study of disease patterns and trends. So Kajiado South may not be the same as Kajiado North or Central or East or West. Each sub-county is different, and depending on their geographical conditions and the time that those incidences occur is how we deal with them. We also have an active public health emergency operations center. The main office is at health headquarters, where our Waziri sits, and it has been active for some time. I'm going to share the toll-free number that we normally use. I'm going to share it in the group, so that when it comes to any emergencies, those toll-free numbers are open for anyone. For flooding, we expect a lot of accidents, a lot of injuries, and of course, we plan accordingly to stockpile essential commodities that are related to that. It is also going to be a bit unfortunate for some patients who are in the CCC. Those patients have chronic or terminal illnesses or HIV and AIDS, because those that depend on routine medication. So if one is unable to access a health facility because the roads are bad, then you can imagine what happens. Same to cancer patients, because we have several cancer patients and other non-communicable diseases that require regular medication. So with that, we'll try as much as we can to do mobile outreaches. We reach out to people. That's normally what we do. If you're unable to come to the facility because of one or two reasons, then we organize ourselves and we reach out to you. We have also empowered our community health promoters, and they're very much aligned with this. They have the skills. We normally do refresher trainings once in a while. So for issues of first aid, they are able to do it at household level before referral processes begin. We also have strengthened the community health systems, because in fact, if you look at the number of health workers or health team, CHPs are the highest in number in the county, about 2,000 and something. So that gives us a very good ground to prevent any incidences or improve on referrals in case anything like that happens. The status of the rapid response mechanism, we have already established. We are not establishing any new one. We already have rapid response teams in every sub-county. And the composition of the rapid response teams include different departments, both in the medical and the preventive sections, and also including the administration. That is the administrators, the sub-county administrators, and the county commissioner's office, because this is a battle that we all have to fight to succeed. We are prepared, and we are going to be more prepared, because even with the recent scare of Ebola, we have already prepared. We had one scare in Namanga, but we were able to handle it, and we thank God that it ended up being negative. We work 24 hours, we don't rest, because some samples need to be taken overnight because of the urgency. So we are an emergency. We are used to these emergencies, so there's nothing new. and we are ready to tackle anything that comes.
So I want us to put together our hands to just thank these panelists for the good response they've given with the makofi ya nyayo. Moja, mbili, tatu,